Hi, and thank you for watching this video and this explanation on the Relative Mobile Pain Treatment Program. I want to talk about a few of the details. We're going to talk about the medical aspect of this, the treatment modality itself, and the operational components, right? And how it works for you as a nurse or technician doing this program, and we'll go into some of those details. So first, I'd like to just go over the basic treatment itself. It's called neurofunctional pain management. This is a non-pharmaceutical, non-surgical, non-invasive treatment modality. It is a therapy model, so that means that it is a treatment that occurs on a regular basis for a period of time. It's an 8-week treatment cycle where the patients are receiving 2 treatments each week. Each of those treatments are an hour long. So ultimately, when a patient enrolls in our program, it is going to be for 8 total weeks, and it's going to be for 16 total treatment events, right? So we'll go into what's happening in those treatment events. But neurofunctional pain management is a combination therapy. It includes high pulse electroanalgesic therapy, IV hydration, and health coaching. So those are the 3 components in the therapy, and it's used to treat chronic pain. We have a very strong track record of success with this program. So the average success rate of people getting out of pain is 85% across the board. That's with about 2 dozen different types of pain. All right. So most common pains are neuropathy, back pain, knee pain, right? Those are the 3 most common ones. But we treat about 2 dozen different types of pain. So we have a lot of specialty pains and different types of things that we can treat as well. So in this treatment modality, you're going to the patient's home as a mobile program, and you will be conducting the electrical therapy with every single event. Every single treatment event has the electrical therapy component, and only one of those events each week is going to have the IV event with it. There will also be health coaching being performed, and the health coaching will be every single event as well. Okay. So that's what's occurring with the patient when you're actually going to their home and treating them. Now, this is a Medicare and commercial reimbursed program, which makes it very exciting, right? It makes it quite a bit easier for patients to want to get involved and do the program when they know that it is covered. It's a covered benefit. Now, I'll put an asterisk on the commercial side of it. We'll talk about that in a moment. But for the most part, everyone who really wants to get treatment should be able to get treatment, especially if they're a Medicare patient. Okay, so that's the treatment modality. I'm going to talk a little bit about each one of those things. High pulse electrical therapy. There's a lot of electrical devices on the market. You hear a lot of conversations back and forth. What we use has been in the market, and it's been FDA cleared and approved for pain treatment for 30 years. So it has an established track record, right? Now, the device itself, it's a Neuromed Matrix PMT mobile system. It's been in the market for 30 years, but in 2018, I took that device and the basic treatment, and I created the neurofunctional pain management modality, right? So added in a structured protocol and in the other components as well, and that's what creates the treatment modality itself. Okay, so if you have ever experienced or know anything about a TENS unit, electroanalgesic therapy, we call it EA for short. EA therapy is high pulse electrical therapy. Um, Very, very easy distinction. TENS unit equals muscle stimulator. EA therapy equals neural stimulator, right? The tissues are quite different. The actual activities are quite different, right? And they do feel a bit different as well. So what is happening with EA treatment? You're obtaining what's called a sustained depolarization. When the patient gets treatment, the high pulse therapy is depolarizing the pain neurons and inhibiting the pain signal. And that's the primary method of pain relief. The second way it's producing relief is that when you're stimulating the neurons, you're getting a release of neurotransmitters and neuropeptides, right? We won't go into all the details there, but those do create a bit of a euphoric effect, and that helps to get patients out of pain. So that's the basic overview of the electroanalgesic therapy. And there are hundreds and hundreds of research articles on this therapy model, right? So there's lots to read about it. And I have publications myself that I can send you when we meet in person and or on a video or Zoom. We'll talk. I'll send you these publications, right? The IV hydration, it's a simple IV. It is a B vitamin complex with an amino acid complex blend and a glutathione um, ingredient. So it's just a very simple IV. But this combination we have noticed over the years has been very successful in helping patients get out of pain. The combination of the electrical therapy and the IV, they work really well together, right? So that's something that we've noticed over the years as part of the development of the neurofunctional pain management protocol is including that IV therapy in it. Not everybody can get the IV, right? Obviously, not every patient is going to be eligible or able to get it because of health reasons or whatnot. Or some of you out there working with us are not RNs or registered nurses, or in your particular state, you may not be able to do the IVs, which is fine. The electrical therapy still works great, and patients can still do treatment. So if you can't do an IV in your state or your credentials don't allow you to, you can still do the program just fine. So just continue to watch the video and keep going. So now you know a little bit about the treatment itself. Oh, by the way, the health coaching portion. Yes, we do see a lot of patients that love that part of it. Most patients with chronic pain don't really, they're not really motivated in lots of ways to improve health conditions when they're in chronic pain all day. So when they start getting out of pain, they typically do have a bit more motivation to engage in health improvement, and that's where the health coaching comes into play. So that's occurring at the same time you're doing the actual treatment with every single event. So patient comes on board with us. They will get out of pain over that 8-week program. It will typically last 3 to 6 months. And most likely, they will come back and do the program again. And they'll repeat that cycle over and over. These patients that you're working with will be with you for the next 10, 15 years, maybe more, right? They don't want to go back to medications. They don't want to go get in line for surgery or any of these invasive procedures that you see at all the different surgery centers and pain and ortho offices, right? They're trying to avoid those things, right? So our program is extremely attractive to patients because of those reasons, right? So some of the other benefits here that you'll see is in the primary care world, uh, primary care and internal medicine and other PCP categories and offices, they don't really have a lot to offer someone in chronic pain. You get medications, and they'll run those medications until they cycle them out or until the patient isn't responsive to them anymore and they still have chronic pain. So we see a lot of primary care offices absolutely love working with us. And so if you're a nurse coming on board with us in your area, you're going to end up having doctors that are going to be referring patients to you. That's one of the things I do like to bring up here. So a lot of you out there probably been recruited or pitched into like cash pay IV companies or services, or maybe concierge medicine services. And you're probably familiar with some of these mobile programs like that. It's very difficult to get referrals in those categories. Everyone's scrambling to try and get these really easy cash pay treatments and these cash pay patients like this. In our program, it's a valuable tool for doctors who need pain treatment for their patients. Right, so you absolutely will get referrals. Okay, we'll go into the marketing here in just a moment, but I just wanted to point that out is that our program is something that doctors do need. It is something that they do refer for and that they write orders for. All right, so you'll see a lot of that. And some of the nurses around the country with us, they have doctors that just completely overload them or flood them with patients and referrals the moment they see that working. Okay. So we'll go over the marketing side of it in just a moment. Um, when we meet together, we'll talk more about these details, but I do like to kind of just go through that treatment cycle so that it's an 8-week program, 2 treatments per week. Each treatment is an hour long. So it's 16 total events, all booked out on your schedule. So if you get just a few patients in our program, it's typically going to create a really nice long-term work structure for you, which is really nice, right? So we like that aspect of it. Okay, let's talk about marketing, and after marketing, we'll talk about the pay cycles and the income and revenue from the program and everything like that. Okay, so marketing. One of the first questions I get from nurses is, "Do you supply the patients, or do we supply the patients?" Right? And I like to respond with, "No one supplies you with patients unless you clock into a hospital and you stand around and wait for a patient to show up. Then you're supplied a patient, right? No one supplies you with patients. In this model, you truly are driving the bus here, or driving the train, flying the plane, whatever. You're the one in charge, right? Our marketing is designed to get patients right in front of you, and then you're the one who actually gets them into treatment. Okay. So that's how that works. Now we have multiple ways we do this, multiple companies we work with who have excellent marketing programs. Some of the companies we have specialize in, like one that specializes in neuropathy, specifically for neuropathy, and they're very good at that. Another company that specializes in sciatica marketing, so they can get patients with back pain and sciatica. So, I mean, there's different companies we work with, and they have a very strong track record of getting these particular types of pain conditions and marketing for that. So what's going to happen is they will turn on the marketing. We'll turn on the marketing for you as well. And some of the companies that are working with us, they will get the patient keyed up right up to the point where they're ready to get started in treatment, right? So they're ready to get started. They'll be introduced to you at that point, right? In some capacity, most of the time it's going to be a phone call if you're available, but they'll introduce you at that point. You're going to meet the patient, talk to them on the phone, and you're going to help the patient get their orders signed, right? So that's the objective here. The patient needs to get orders signed by their current doctor, right? Our company is structured as a group practice. So we are a medical practice, but we actually let the patient's current doctor order treatment for the patient. So that makes it easier for the patient and also easier because the doctor gets to maintain the patient in their practice without referring them away from their practice. That's another asset that of our program that doctors like. And we see that happen all over the country as well. They get to kind of keep the patient under their control, which they love. So their doctor is going to sign the order form. Once they sign the order form, you are free to now schedule them and get started with treatment. The benefit for you that their doctor signs orders is that that referral door is now swinging wide open, right? The moment that they see this treatment work for a patient, you've already connected with them, the doctor, that is. You've already talked to the doctor, potentially talked to them. The patient asks the doctor for treatment, asks them to sign the orders. You're directly involved in that process. You may have had a conversation with the doctor, maybe you haven't, but either way, that referral door is wide open. And when they see that patient getting out of pain and you're giving them the updates, oh, here's a quality of life improvement. They went from an 8 to a 2 after just 3 weeks, whatever the success is. You're reporting that back. The doctor sees it, loves it, says, I've got a dozen more patients with that same problem. Can you treat them as well? Right. And we're going to train you on how to talk to the doctors and everyone to encourage the referrals and encourage that to happen. But some of these doctors out there are desperately needing an option like this. And so the moment they see this working, it's covered by Medicare, covered by insurance, they'll start referring patients, right? And we see that all the time. Okay. So that's the exciting part of it. And that's how the marketing works. So I don't want to say, we can't use the word guarantee here, but my goal is to get you a full load of patients within the first 2 months of you starting the program. Now, that's 2 months from when you've actually been trained. All right. So the first step is to get the equipment ordered. Second step is to get you trained, to get the marketing process going, and then you're ready to see patients. We want to get you a full load of patients within the first 2 months. That's our goal. We'll work hard to do that. I wish that I could, provide a guarantee, but everyone out in the country who's watching this can be from anywhere. There's no way for us to know how quickly we can get all the patients on board. All right. But in most places, I mean, most areas of the country, we can definitely get the leads flowing and the patients flowing, right? So we turn that on for you when you come on board with us, and we'll get the marketing ramped up and going. Now, aside from the specialized marketing categories like neuropathy and back pain, where we're driving specific, pain conditions into the program, we also have general marketing. Those will be leads that come in the door. Those leads are any types of all sorts of pain. Some of them may be different types of insurances that may or may not be that great to work with. But there's going to be some outreach from you on that. So you'll need to call those leads, call those patients as well. But there'll be a lot of patients that are just being delivered to you as, hey, they're right up to the point where they're ready to get started in treatment, and they just need someone to help get them across the line and get them into treatment. So most of the time, the conversion process is pretty simple and pretty quick and easy. Okay, so I just mentioned insurance again. Let's tackle that real quick. Medicare, original Medicare, all day long, and all commercial insurance. It is reimbursable, but we are no longer attempting to bill commercial insurances ourselves. So what we do is the patient will pay in advance for treatment, and they will submit their own claims, and we will provide them with their super bills and their documentation and everything they need. They'll get all of that stuff the same way that a medical office would have created it and billed it. but the patient will bill their own insurance. So the patient needs to pay for treatment in advance. And I know some of you are thinking, oh, well, that's really difficult. Patients don't want to do that, or that's going to be hard. There'll be fewer patients wanting treatment if they have to do that. It's probably true, but that's better than you going out there and an insurance company telling you that it's a covered benefit, because they will. We will do the insurance verification. Our team does that. And in that verification, we will ask them, hey, do you cover these codes? Do you cover treatment for chronic pain in this particular condition for the patient? Yes, we do. Our codes are standard. Everything we do here is standard and normal. Yes, they say yes, they cover all of this. Getting them to pay for it is a completely different problem, right? They'll say they cover it, but then they don't want to pay for it afterwards, and they'll fight you on everything. And everyone knows commercial insurance is the worst, right? Commercial health insurance. All doctors across the country know that. So that being said, we have discontinued the effort to collect or to bill and collect from commercial insurances ourselves and then pay nurses because of the frustration of having to wait. So that's the process. Ultimately, doing it this way, you will collect and curate an ideal clientele of patients over time. But again, there are enough Medicare patients in chronic pain to where you never need to worry about commercial insurance patients. Okay, so when we're out there and you're marketing, we're seeing this, we're prioritizing the Medicare population because there's so much need in that population. We do bill Medicare directly and receive reimbursement from Medicare. So we are doing that directly, but with commercial insurance, it's the structure where the patient pays in advance and they submit their own claims. Okay, that's the insurance conversation. I will be happy to educate all of you on insurance after you come on board with us. There's a ton to know. You don't really have to deal with it that much because we have a whole team that handles all of that. But you're not having to do any of that work. You don't have to do verifications or pre-auth or anything like that. We're handling all that stuff. So that's what we're doing. Okay, so let's get to the pay part here. So across the country, you're going to average about $150 per treatment event. Now I have to I have to kind of put that in perspective. Every state reimburses a little bit differently, in the world of Medicare, and cost of living is factored in with all these. So some states it does pay a bit less, and some states it's a bit more. But the nurse should be taking home on average 150 per treatment, and that's your take-home pay, right? So put this in kind of a money perspective for you. If you had 6 patients in treatment, which 6 patients would be roughly a half-time load. 6 is half-time, 12 is full-time. Okay, 6 patients, they're all of them are getting 2 treatments a week. So that's 8 treatments a month. So if you're averaging 150 and you've got 8 treatments a month, that's $1,200 times 6 patients. So that's $7,200. Right. So if you have maintained 6 patients in treatment, that's $7,200 a month for part-time. Not bad for part-time. Right. If you go for full-time and you want to carry a full load of patients and have about 12 on your schedule, that's going to be 14,500. Right. Now, that's decent money, right? It's decent income. And with Medicare, it is a flat rate. So when you're treating Medicare patients, it's a guaranteed flat rate payment for you. And with commercial insurance, they've already paid ahead of time, so you're getting paid for that as well. Now, when it comes to some of the commercial insurance and some of these patients that don't have enough money to pay the full amount, obviously there's considerations for that. You as the nurse are the one who gets to decide if something changes. So we have a standard cash pricing and standard pay pricing that patients will pay if they have commercial insurance. If there's any changes to that, you're the one who approves it, right? Because it directly impacts you and everyone. So we'll talk through all of that when you come on board, but that's how that works. You should be able to average 150 per treatment across the country, and that's what you can expect when you're running kind of your business model calculations for getting started with us. We do our payouts once a month after the conclusion of the month. We'll spend the next couple of weeks in the first month doing the payouts, right, for everyone. So you can expect that to cycle once a month. Okay. So as we're moving forward in this, remember, you are an independent contractor, right? And one of the reasons that we structure it this way is so that as an independent contractor, you are your own business, your own company, right? So that's how the state recognizes you. That's how we structure it. One of the main reasons for this is so that you do have the ability to grow and expand, right? So every one of you who come on board with us is your own business and your own company, all right? When you start getting all those referrals, when you start getting all those patients, You can absolutely expand by hiring your own staff. You can hire your own people, right? We have nurses all over the country that have their own employees and their own staff. Okay. So let's just say for a second you get started with us, and in the first couple months, you get that full load of patients that we're talking about, which would be 12 patients over the course of 2 months. So you're ramped up, you're going, you got patients in treatment, you treat them for 8 weeks, and then they're out of pain for a few months, and then they come back and get into treatment again. But just remember, all those doctors that signed order forms are now referring you patients. All those patients who got out of pain are now telling their friends and family, and they're sending people. Right? You can only handle 12. So, 6 months later, actually probably sooner than that, 3 or 4 months later, you're overwhelmed. You've got way more referrals, you got way more patients coming in than you can possibly handle on your own. So at that point, what do? You can absolutely hire someone to help. We'll go into that later, but it's a perfectly fine way to grow, and it allows you to actually grow. Now, a lot of you out there are thinking you're going to do this part-time, and that's your only plan. Totally fine. We've got several dozen nurses who do this part-time. All right. Some of them want to stay part-time because that's all they want. Some of them will eventually go and do more. And then I've got some who are trying to make an actual operation out of it, and they'll have multiple employees, which is great. So our structure allows you to do any of those levels of activity, right? So I encourage all of you to think through that. Some people find the idea of growing and expanding pretty exciting. I myself think that's a great way to go. If you were going to get out there, get away from the hospital, get away from bedside nursing and all that, and do this, might as well be able to make something strong out of it, right? And have a whole operation. So pretty exciting. Okay, so I do talk about I mentioned in lots of the videos, so the Neuromed PMT, Neuromed Matrix PMT mobile system. It's a pretty expensive piece of equipment. Nurses do need to own their own equipment and supplies. The equipment package for this is $30,000. Most nurses are getting this financed, and there's several companies that do this. I know a lot of you are probably, kind of pausing at the moment and saying, "Oh my gosh, I can't do that." We have a lot of nurses who can't do financing, can't afford to pay for the equipment, and we find ways to help them get it. So don't run away because of the financing and because of the cost of the equipment. We have lots of ways to help people do it. Now, the most common way is to do traditional equipment financing with one of these companies that specializes in medical equipment for professionals. So that oftentimes is the best way to go. We see that all the time. It works great. The other options are we have several groups that support us. There's a nurse coaching group we work with. They help get equipment funded, and they will help get nurses going. We have other investors and people who put money in to help nurses get up and going. So there's lots of options here. But I do have to point out that the whole objective here is for you to end up owning the equipment yourself. That's the purpose of being an independent contractor, is to own your own operation and to actually own the equipment and own the supplies and take ownership of your work. All right. So we'll find a way to get the equipment in some way or another, whether it's financed or it's provided in some capacity. As you're going, you are buying all your own supplies. At the beginning, buying the equipment comes with some of your IV supplies. As you go, you'll continue, you'll be purchasing those on your own, and we'll give you the accounts set up to do that. So that's how that works. And when we talk, if you have lots of questions about all of this, I'm very happy to chat with you about it. Just remember that I'll recap it all. An 8-week program, patients will stay with you for years doing this. You're averaging $150 per treatment. Again, a single patient in treatment is a 16 event cycle. So $150 times 16, that's what you're looking at with each patient that comes on board. You do own your own equipment and your own supplies, but the revenue from this is pretty substantial. You should be able to overcome any of the additional costs and the equipment that you're having to finance to get started. So that's the model. That's how it works. We've got nurses all over the country doing this. Some people do amazingly well. Other people have a pretty slow start. It is almost entirely based on the mentality of the nurse getting started, right? I've had nurses that started almost in exactly the same day. One of them is successful in making over $10,000 a month within just a few months, and the other one can't hardly get anything going, even with all the marketing and all of the effort we provide. It just has to do with mentality. And when I talk to you face to face or just in the Zoom, I'd be happy to go over some of those details. Okay. So reach out to me, book a meeting on my calendar. We'd love to get you going. I know you'll love this program. We're expanding across the nation. There's a tremendous need for this. The patients love what we're doing. It overhauls their life, a complete 180 from downward spiral in chronic pain to upward spiral, positive motivational outlook and getting out of pain. You will love it, and the patients will love you as well. Looking forward to talking to you, and thanks for watching.